For Dr. Olabunmi Agbola and her fellow residents, being able to correctly diagnose a patient's medical problem is job one. But making a correct diagnosis sometimes involves more than just medical issues.
There's many factors of a patient's life that affect their health care. So we can definitely individualize the care in order to fit that patient.
In her last year of medical school at the University of Illinois at Chicago, Dr. Agbola learned how to individualize care by participating in a study using actors as patients. The actors were given a medical problem along with other non-medical concerns. It was the students' job to listen and probe for clues that would help them with appropriate treatment plans.
I'm thinking about getting a hip replacement so that I could take better care of my son.
Is your son needing a lot of care?
He's dying of muscular dystrophy.
You know, for the hip surgery, you will have to be out for recovery, you will have to go through rehab.
Wow, I can't believe I didn't think about that.
Individualizing care means appreciating aspects of the patient's life, we call it their context, that may mean that they have to be treated differently than other patients with the same disease.
Dr. Alan Schwartz and fellow co-authors at UIC studied more than 100 fourth-year medical students. Some received training on contextualizing or individualizing care, and others did not.
In our group of medical students who had not received extra training, about 25% of them correctly managed patients who had complicating individual factors. When they'd received training, 2/3 of them were able to manage those patients.
The study appears this week in a theme issue on medical education in JAMA, Journal of the American Medical Association.
It becomes very important in the fact that we need to definitely look at our patients as individuals that have lives outside of what we see in our practice.
The study is important because failure to take into account individual patient context can lead to medical errors that are just as bad as providing the wrong dosage or the wrong drug.
Catherine Dolf, the JAMA Report.